Wendy Gillette with Small Cap Nation, joining you today for the NASDAQ market site here in Times Square. And joining me is Dr. David Goldberg. You're a dermatologist. Tell me more about your 4 practices.
Well, first, it's a pleasure to be here. I'm the Director of Skin Laser and Surgery Specialists of New York and New Jersey. We have 1 office here in Midtown Manhattan and 3 in New Jersey. And I've been practicing for 30 years with really an emphasis on skin cancer treatments and all of the non-invasive cosmetic treatments that are available today.
Now, you told me when you started out 3 decades ago, not to age you, but that these technologies were used back then, but then they kind of went away. Why?
It's an amazing thing. You know, this superficial radiation therapy made by Sensus Healthcare really is relatively new in the sense that they are new. But the technology itself is not so new. When I trained in dermatology at NYU some 30 years ago, we did a lot of superficial radiation therapy, both for treatment of many skin cancers, as well as for the treatment of keloids, an impossible scarring, disfiguring problem. And the treatments were successful. The problem was the technology disappeared. And the technology disappeared because, 1, the boxes that delivered this treatment were just way too big to put in private offices, and 2, the technology was unstable. It constantly broke down. And it took almost 3 decades, and now for Sensus Healthcare, to bring us machines that are small, can be easily placed within a private practice setting, and just are stable. They just never break down.
How well does it work for your practice?
And so we have, as I said, a practice that is organized towards skin cancers. I'm a Mohs surgeon. That's a technique that microscopically traces skin cancers out under the microscope. It's a surgical technique. It has a high cure rate. I run a certified training program for doctors to learn this. And so I've been doing that for 30 years, and it's very successful. The problem is, 1, it is surgical, and no matter how good we are, there has to be a scar. And 2, there are areas on the body where surgery is not necessarily appropriate for certain individuals. So as you get to this elderly and progressively elderly population with skin cancers on their legs where they have swelling, or some men who have large skin cancers on their scalp, surgery is really not appropriate for them. And this approach, we call this SRT, or superficial radiation therapy, has cure rates well into the high 90s, and there's no surgery involved, there's no pain involved, there's no wound, and treatments take all of a minute.
Wow, a minute. How long have you been working with Sensus?
So I've been working with Sensus for almost 3 years now. As I said, 1, we do all the skin cancer work, but probably the most rapidly growing area of treatment that we're using this technology for is the treatment of keloids. And people sometimes don't understand what keloids are.
Yeah, explain that.
Well, we all get scars. I mean, you cut yourself, you have surgery, you get a scar, and most of the time that heals pretty well. I mean, not like it, but it heals pretty well. But there are certain individuals, and it's more than 1% of the population, who develop scars that become bumpy, and they're almost like parasites. They grow beyond the margins of the original scar. They're large, they're uncomfortable, and they are notoriously unsuccessfully treated with lasers, with surgery, with any other approach. We then treat them with this superficial radiation therapy, anywhere from 1 to 3 treatments. It's less treatments that we even use for skin cancer, and the cure rate is into the 90s. So we've transformed a population of patients that had a cosmetically disfiguring condition that we were never able to treat.
Why don't other treatments work well?
Well, the problem with keloids is there's some sort of turn-on mechanism. You get an injury, and our body normally puts down collagen to repair that injury. Whether you scrape yourself, you get a mosquito bite, you have surgery. And most of us do a pretty good job at that. For some reason, some people, and some of it is genetic, some people tend to overdo that. They produce much more scarring than is necessary to promote healing. We don't know the reasons why. And the superficial radiation therapy inhibits that ability, and therefore they don't get the bumpy scars.
Some other patients that this treatment is right for?
And so typically it's a person who may have had their ears pierced, and normally that you have your ears pierced, that goes perfectly well. Some people, they get a big bumpy scar there, typical situation. People maybe more middle age who've had surgery on their chest get big lumpy scars. And then there are a certain group of patients with acne, which is seen in 80% of the population, who heal with bumpy scars, and we can get rid of those very easily with superficial radiation therapy.
All right, and I understand, Doctor, you're going to be coming back to us on a quarterly basis.
There's going to be more and more knowledge, and we'll give it to you.
All right, thanks very much for being with us. And for more, join us on smallcapnation.com. I'm Wendy Gillette with Small Cap Nation.